Alright, this is just a quick video to show the consult rooms, which is in the ER where we meet with our patients. Very nice, very lovely, very calming. And this is the other consult room. I will add that I like this consult room better because the other one, there's always air blowing in it and it's loud and it's hard to have a conversation in a nice quiet tone. You have to speak louder. It's always cold in the winter because the air, I don't know, the air just always blows. And then you come here and you're going to walk the patient to the exam room. So we're going to walk down this hallway. This is what you walk through, seeing this is a very routine, normal day to have this kind of a messy stretcher. The charge nurse area, the ambo area, and now we're walking towards the exam room. So we have stretchers everywhere, registration, passing by. We have the staff area, the patient care area. We see the crash cart, housekeeping's area with their, routinely seeing the trash can out like this and their housekeeping cart. This is just our area that we use for our orthopedic stuff. Going down the hallway, this is our office doorway where we have our two computers in our office area. You have now our exam room entryway. We share this with medical patients with the ER. So we do move our stretcher over and replace it, take their stretcher out and put it in the hallway. So it's another added clutter in the hallway when we walk a patient into our exam room. But this is our stretcher, so we move it over so that it allows the ER to have their stretcher when we're in this room for a period of time. They use this room for pelvic exams and also other kind of medical care. As you can see, it's rather bland medical room. It's cluttered, not very conducive to trauma-informed care. Just more stuff cluttered. That room, that doorway is the entry-exit door to get behind triage where patients are coming and going all the time. And then walking into our bathroom. Which is a simple bathroom. Quite dirty. They've cleaned it. It just looks gross. No shower in here. No place for a patient to really put their clothes down. We just lay a sheet on the floor there so that they can stand on it and remove their clothing and leave their clothing on the floor, which is fine because I guess they, we do collect their clothing sometimes. About maybe 20% of the time we collect their clothing. And then we can use that. We have these hooks put in there so we can hang a gown on it so that when they're getting undressed, they can take the gown that we hooked up there to get dressed. Anyway, so this is our bathroom. And the room. We usually leave this in place. Again, we remove the pelvic stretcher. We try to come in here. It takes us about 10 or 15 minutes to wipe everything down, move the stretcher out, move our stretcher over. We actually have to lock our stretcher up, and we have a sign on it. Usually there's a pillow, but the pillow was stolen last night because it was here last night when I left, and it's not here now. But we have to chain it up because otherwise we know that this stretcher will walk. It's a GYN stretcher. It can convert from a regular looking stretcher to a pelvic stretcher. So these are our cabinets that we have some supplies in. I had facilities come, or carpentry, and come and put cabinets in here for more supplies. The more supplies, this is training supplies that we have on this cart.